Assalamualaikum warahmatullahi wabarakatuh.
Let's talk about mental health issues.
And particularly, we're going to be talking about suicide ideation, which is the idea of suicide when one's thought is preoccupied with the thought of ending their life.
Suicide and mental health cases are rapidly rising. Let's explore warning signs, risk, action, and safety plans. Let's take a closer look at contributing factors that lead to suicide. Suicide ideation warning signs. Substance abuse, hopelessness, withdrawal, purposelessness, self-isolation, chronic pain, recklessness, cry for help, loss, fear, accidental, feeling like a burden. Risk factors. Who is at risk? The risk suicide increases with age. Gender, middle-aged men more than women. People with previous suicidal behavior, people affected by mental health decrease, people with psychological issues, people with family history of mental illness, people taking prescription medication with suicide, depression warnings. In some cases, depression can lead to suicide. Talking or behavior of someone should be taken seriously. Watch for the warning signs. Harming oneself, experiencing trapped emotions and hopelessness, reckless behavior like speeding, visiting or calling loved ones to say goodbye, getting rid of precious and prized possessions, verbally saying phrases like "nobody wants me" or "I'd rather be gone." Beware of extreme emotions. Cognitive behavioral therapy, CBT, is beneficial. Resilience factors. Keep trying even when things become difficult. A strong support system of family and friends, good health care, hygiene practice, spiritual or religious practices, implementing positive behavior, and being inventive in your thinking and doing. Assessment and prevention. Establish healthy rapport, build self-esteem, reinstate strength, access medical history records, care and support, acknowledge and validate feelings. How can we help and take action? Suicide prevention. The key questions. Be direct, ask about their feelings. Have you been thinking about self-harm? Are you suicidal? Explore their reasons to live. What kept them from self-harming? Explore strength-based questions. Immediate action. These are some of the safety precautions we can take to help. Do not leave them alone. Implement a safety plan. Family and support 24-hour care interventions. Restrict care needs. Address underlying issues. Prevention. How do you know someone might be suicidal? You may hear statements like, I wish I was never born. I feel like I'm just taking up space. Everyone's life would be so much better without me. If hearing such statements worry you, then you should. These statements are warning signs that a person is thinking about suicide and should be taken seriously. There is always help. Immediately reach out to 911, Mobile Crisis Rapid Response Team, MCRRT.
Assalamu alaikum, this is Dr. Taya Wahid. Suicide is basically when people have lost hope and they want to end their life. This thought and wish does not just develop in one day. It is due to series of events and emotional battles which they cannot handle it anymore. We've seen children, adult, and even elderly people. They come with variety of symptoms. The symptoms can be simple as poor sleep, decreased appetite. They have no interest or pleasure in doing anything. They feel tired, they have low energy, or they feel bad about themselves. They feel they've let their family down, or they wish they were better off dead. There will be people who would actually try to hurt themselves by using objects to harm themselves and to cause them pain, or they would wish there would be an accident and it will just cause them death. What we have to do is that we have to find out from the beginning, find the trigger and treat that. We have to help them from the beginning to prevent them having this feeling of suicide. Thank you.